This is the Injury Report, presented by NYU Langone Health. Celtics big man Kristaps Porziņģis suffered a rare injury Game 2, which has left his status for Wednesday's Game 3 up in the air. So, for today's Injury Report, we're talking with Dr. Dennis Cardone, Chief of Primary Care Sports Medicine at NYU Langone Health. Doc, welcome back, man. How you feeling today?
I'm feeling good, much better now that I'm back here. Always a pleasure to be here. Thanks so much.
All right, thanks for coming back on with us. I know we usually talk New York athletes on Injury Report, but, you know, it's NBA Finals. There's a lot riding on this. And plus, Porziņģis used to be a Knick, so we can get away with it. Let's get right into it. So it's been reported that he has a torn medial retinaculum, allowing dislocation of the posterior tibialis tendon. Three-part question, Doc. One, how is my pronunciation? Two, what in the heck is this injury? And three, is this common in basketball and in sports?
Number one, you are on it. Your pronunciation, phenomenal. So hats off to you. Great job. You know, an uncommon injury, but one that you can see in high-level athletes in a high-level sport, obviously explosive like basketball. So there's a tendon that wraps around that inside part of the ankle called the posterior tibialis tendon, and it's held in place by a roof, a sheath of tissue. And in a rare instance, that sheath can tear, and now it allows the tendon to come out of place and dislocate. So that bump that we have on that inside part of the ankle, now that tendon is traveling back and forth over that bump, and it could be quite painful, irritating, and can really affect his performance on the court if he were to play.
Well, he played for an additional 6 minutes after the injury. He made some plays. He actually beat up Kyrie a couple times, and he never went back to the locker room. Now that he's had 3 days of rest and rehab, what could be his potential limitations for Game 3?
You know, like most injuries, it depends on the severity of the injury. Did he have a complete tear of that sheath, of that roof, or was it a partial tear? And that makes a big difference. But let's assume the worst, he had a complete tear, and now that tendon is dislocating. That can be quite uncomfortable, quite painful, really affect his explosiveness on the court, jumping, pushing off. And there's also some long-term consequences that you continue to injure the sheath, and if it needs to be surgically repaired after season, it makes the surgery more difficult. And you could also injure the tendon. So it's kind of a tough situation, a bit of a tough call. And a lot of it's going to depend on symptoms, how he's performing, and also to take into account risk of further injury.
Can you take us through what these last 3 days have been like with he and the Celtics trainers? Like, what's the rehab been like, and how are they going to manage this injury for the rest of the finals? Let's say if they go 7 games.
Yeah, so you rest assured, you know, they've been doing a few things. Number one is they've really been testing it and see how he performs, right? Having him do those explosive type activities, again, pushing off, cutting, pivoting, jumping, and seeing how he tolerates it. You know, it's a difficult injury to protect, meaning, you know, without the surgery or pre-surgery. So they could try taping, they could try bracing, to try to stabilize that tendon. And it's really a big question mark about how effective it will be. But you're absolutely right. You know, they're trying everything, seeing if they could stabilize that tendon, keep it in place, allow him to play and be on the court. And it's a real question mark how effective that will be.
Yeah, I mean, it's like this guy can't buy a bucket, no pun intended. He just came back from injury, and now he has this to deal with. You mentioned the possibility of surgery in the offseason. What else is he looking at in terms of his offseason?
Yeah, if that sheath is completely torn, he'll need surgery, right? And the outcomes of the surgery are quite good. He'll do well, but there'll be a period of immobilization somewhere from two to 3, 4 weeks after the surgery, and then starting a rehab program. So if it does need surgery, rest assured it's going to be done immediately after the season, and he should be ready to go hopefully by the fall.
Was this because since he did come back from that injury, could this have been an overcompensation thing, or is it just that's the way the ball drops sometimes?
That's really a great question. You know, so it's not a common injury. So I think most of us would say His previous injury was on the opposite leg, so potentially he was putting a little more stress on this side. And that might have pushed it over the limit a little bit and been a causation or a cause of this injury. And also the fact that he hadn't been playing as much, right? So those two factors probably had some role in this injury.
Yeah, well, the bookies are paying attention. Ever since this injury was announced, the point spread has went down when it comes to the Celtics. So all eyes on Game 3 tonight. Doc, thanks for joining us today.
A pleasure. Thanks so much for having me.